Hi, I'm Emma Barker-Bonamo, Senior Editor at Time, and I'm joined today by Bonnie Castillo, the head of National Nurses United, and Ai-jen Poo, the director of the National Domestic Workers Alliance. Welcome.
Thanks so much for having us.
Thank you so much.
So Time readers just voted essential workers as the winners of the 2020 Person of the Year reader poll. It's clear that we as a society really appreciate essential workers, but there can be a gap between that appreciation and real action. What is the reality that you see frontline workers that you work with facing on a daily basis?
Sure. I mean, I think for nurses, we here we are 9 months into this, and we are still working without the essential supplies that we need, the staffing, the PPE. And I think what is most bothersome is, having been betrayed by our employers and government. And so that for us is produced a great deal of moral distress. And, this didn't have to be this way. And we know what we need. And so for us, I think that is the most challenging. And right now, as we go into this surge, it is only going to get worse. And we are, as you said, an essential workforce, predominantly women workforce, domestic workers, nurses, and yet we're so devalued. This work has been historically devalued, and at this moment, this pandemic has just amplified that. So for us, we have to speak out, and we are going to speak out. We're not going to be silent, and we understand our role as union nurses, that we have a protected voice to speak out. So that's what we're doing.
Yes, and I'll just build off of that by saying that, I think essential workers need the same things that all of us need, the ability to keep themselves safe and take care of their families. And as Bonnie said, we're 9 months into the pandemic, and many essential workers are risking their lives, their safety every day, and their kids are home from school. They don't have childcare. They don't have adequate wages. They don't have any hazard pay. Many don't have health care, even as they're keeping us healthy. And they don't have paid sick days or paid time off if they do start to feel sick or unwell. And what we're finding is that oftentimes in many workplaces, many essential workplaces, the burden of safety is being put on the workers with the least amount of resources and power to navigate the situation. So you have home care workers who are having to pay out of pocket for regular COVID tests, for PPE, and for safer modes of transportation to get to and from work. And it's just a really impossible situation. So I would say that it is incredible that we are recognizing the work of essential workers for the first time in many instances, right? Many of these jobs were really invisible to us before. We're now seeing it, and we can't unsee it. And we have to do more to ensure that our essential workers have the protections they need to keep themselves safe. And that's everything from hazard pay to healthcare and childcare, and also a voice, a seat at the table as cities and states think about what it looks like to reopen and rebuild, to really draw on the experience of essential workers and get their perspectives, their point of view, their ideas for how to reopen in a way that is safe, not just for consumers, but for the workers who are going to have to really ensure all of our collective safety.
So a lot of these problems and potential solutions seem really big to the average person. What can people who are not essential workers, but also, aren't in charge of big government decisions do to help support these workers?
Well, as nurses with our patients, I mean, we enjoy a great deal of support from our patients and the community, and we are advocating for them to stay home, to wear masks, to engage in robust hygiene, and that's a real concrete way of how to help us. And we've seen that there have been a lot of corporate interest pushing to reopen too soon. We warned against that. We know that there's big pushes to reopen the schools, which will, we understand the danger of asymptomatic transmission and how deadly that is. And so, we've been out there being a vocal force, and I think that the biggest challenge is the misinformation and the fact that the highest level of leadership in this country has actually entertained the idea that this somehow will just go away or that it's a hoax. That's what we're up against. And so we're hopeful with the new administration that we'll actually have assistance, a partner, and that we'll actually be able to conduct policy by science. That's simply what we're asking. Everything that drives our practice as nurses involves science, and we need to get back to that. And so that's really, I think for us, that's how the public can help and to engage in, as they did in this last election.
I would just add that it's really important that our members of Congress and all of our elected officials hear from us, that we want essential workers to have protections. There is a framework for an Essential Workers Bill of Rights that Senator Warren and Representative Khanna have championed in Congress. And there will be immediately conversations about COVID relief and economic recovery. And our members of Congress need to hear from us that we want to make sure that essential workers have protections, that they have the relief that they deserve. And we want to make sure that they have the care that they deserve, the ability to take care of their families. And all of that is going to be on the table in live conversation in Congress as soon as it reopens in the new year. And so all of us as voters, as concerned community members, have a huge role to play in ensuring that essential workers are protected.
Frontline workers are some of the most at risk, both in terms of health, but also because many of them are low-wage workers economically. There's this sort of push and pull between reopening businesses to restart the economy and shutting down businesses to stop the virus. What do you think is the correct balance in order to protect your workers and also protect their livelihoods?
Well, without a doubt, those essential workers need maximum support, and that means other social services types of support as well, including paid time off and unemployment, maximum unemployment being, right now we have to pay people to stay home. We have to. Science will dictate where the virus goes. We will not get a choice in terms of how it spreads. That means that we have to make decisions based on human need and care, which is what essential workers are giving, versus protecting the bottom line. Now, without a doubt, we want our economy to be healthy again, but part of being healthy again is protect those essential workers and protect workers and families during this time. Imagine if we would have done that and started that 9 months ago. The reality would be so much different in terms of what we're facing today. So now is not the time to double down on what has not worked. This has not worked. Reopening didn't work. Now is the time to get it right. And it takes bold leadership, without a doubt, and takes bold public policy that is focused on the public good. We have to do that. There's no way around it.
Ai-jen, the workers that you represent in domestic work maybe are slightly more affected by the economic shutdown. What's your perspective?
Well, domestic work, it's true. It's a full-blown depression, economic depression for domestic workers right now. At the beginning of the pandemic, we saw 90% of our workforce lose jobs and income. And over time, it has improved somewhat, but we're still at a 40% unemployment rate right now for domestic workers. And the levels of food insecurity and housing insecurity are literally like nothing I ever could have imagined in my worst nightmare. And so we do need relief, and we do need to recover economically. But I do believe that we have to do so in a way that is responsible and that takes care of the people who've taken care of us this whole time. And one thing that is a kind of a simple measure or step that can be taken is to ensure that essential workers and frontline workers like domestic workers are a part of the process of deciding how and when we reopen. So there's some places like Harris County in Texas that have essential worker boards that have brought workers from different essential industries together to be a part of the conversation about how and when reopening happens, so that their perspectives can be a part of the strategy. And I think increasingly we have to draw on the experience and the insight and the wisdom of our essential workers in terms of thinking about what it looks like to recover safely and also equitably. This is our moment as we reimagine what it looks like to recover. This is our moment to really address those issues, and it will disproportionately affect women of color, like domestic workers, who've been systematically left behind from our protections and our economic policy in the past. So this is a huge opportunity here. I know we are in dire straits and we're dealing with a raging pandemic. And I believe that on the other side of this, if we design our recovery right, we can actually get to a more equitable, more sustainable economy for the 21st century.
The Biden administration just announced its team of medical advisors. And Melinda Gates also recently called for Biden to appoint a czar for caregiving specifically. Are either of you working with the incoming administration on new policies that could help essential work and frontline workers?
Yes, already President-elect has actually been meeting with workers, including healthcare workers, and listening. So, we have been at the table already, and that is without a doubt, it's critical. And we have submitted extensive comments and analysis based on our experience and what is needed. And the things that are needed are actually, we can do them pretty quickly. Invoke the Defense Production Act to mass produce the PPE that will protect all of the essential workers. That is so critical. If we, and we have the ability to do that, to actually have an OSHA standard that is like a temporary infectious disease standard, that too would protect workers, all workers. And so we are looking forward to working with this administration, and already they're listening to us. So we're hopeful.
Exactly. The Biden-Harris campaign, before they were elected, and now our president and vice president-elect had a plan that was a part of their economic recovery agenda called the 21st Century Caregiving Plan. And it was a plan to invest in childcare, home care, and paid leave, basically what working families need in order to take care of their loved ones from across the lifespan, from children to older adults and people with disabilities. And it is a really transformative vision. We in this country have never really invested in our care economy as fundamental infrastructure for our economy to function. But really, what could be more fundamental than our ability to care for our families while we're working? And so this notion that we need to invest in our care economy as if it's infrastructure, as a fundamental first step to getting our economy back up and running, getting America back to work, it's critical. That's what I'm really excited to work with the new administration on moving forward. And I love Melinda Gates's idea about having a care czar, or somebody who's really leading and championing this effort within the administration, because it will require participation and engagement across many agencies. I mean, I feel there is momentum to address some of these big, big challenges that we've faced for a long time, and to do so with courage and to meet the level of crisis that families are facing right now.
What gives you both hope for the future in such a difficult year?
I would say the workforce itself, which is essential, is not replaceable, will never be automated. And is so strong. Just today, you know, during this pandemic, we all have our personal lives and our families get sick. And I have to say, I'm dealing with right now with my brother who's terminally ill and is being cared for by a nurse who has her own healthcare insecurity about coming to work and not having adequate PPE and going and being afraid to go home and infect her families. Yet her focus has been the care and dignity of my brother. And I just think, wow, who does that? That to me is a fierce warrior. And I'm so proud to be fighting by their side because I know that we can win.
The fact that so many of us are recognizing the incredible courage of nurses like the one that Bonnie just named, the fact that we are recognizing essential workers as people of the year, and that we're willing to do more than applaud and recognize them, but actually begin to make the changes and take action that will change the material conditions of their lives to keep them safe. That is what gives me hope. We have momentum now, and we can't unsee the things that we've seen in this pandemic. And I believe that the good people of this country will move the kind of change that we need to see for essential workers forward.
Well, thank you so much to both of you for joining us today and giving us such great insights.